Dear friends, I am Dr. Thompson Akwo, international political leader, physician, and communicator, certified expert in global health, subspecializing in global health communication and promotion. The 2022 Covid-19 Global Summit, hosted by the USA, Belize, the CARICOM chair, Germany, the presidency of the G7, Indonesia, the presidency of G20, Senegal, African Union president, are the co-chairs of the COVID-19 2022 summit that will be hosted virtually at the White House. And the focus for this year is one, recommitting intensity to global response. Two, vaccination of the world. Three, protecting the most vulnerable. And four, preventing future catastrophes or pandemics. This Global COVID Summit 2, which will be held tomorrow, Thursday the 12th, is very, very important. There are going to be governments, international multilateral corporations, WHO, the World Bank, the World Trade Organization, other nations like South Africa, Canada, Japan, South Korea, India, private corporations like Wellcome, Google will be present. The Clinton Health Initiative, Bill and Melinda Gates Foundation, the Global Alliance for Diagnostics, the International Coalition for Epidemics Preparedness, so the civil society, the private sector that has committed in helping the world solve these pandemics will all be part of the Global Summit 2. The Global Summit 2 will be building on the Global Summit 1 successes. And we will have short presentations that will be done by the co-chairs that I've listed above, starting with President Biden of the United States. And then participating sessions will be grouped under three headings. Shots in the arms of people, expanding global access and vaccination reach, preparing for the next pandemic. It must be noted that the United States had withdrawn from the World Health Organization when President Trump was in office because of misunderstanding with the nation of China and accusations which were wrongly leveled at the World Health Organization's headquarters in Geneva under the directorate leadership of Dr. Tedros Ghebreyesus. South Africa, Canada, Japan, India, Colombia, South Korea welcome, and these other organizations will be joining some of the discussions in order to make sure that the world successfully transition from the acute phase of this pandemic to the next phase. In our meeting yesterday with Dr. Tedros, the Director General of the World Health Organization, Dr. Ryan, Maria Van Kerkhove, and the others, some of the issues which will be discussed in this second summit were alluded and addressed. This is an opportunity for more commitment from certain countries, certain private corporations, non-profit, international corporations like Bill and Melinda Gates Foundation, and the work that they do around the world in the fight against pandemics, epidemics, and related global health issues. Recommitting intensity in a global response that was built around the 8 pillars that was sent to member states by the World Health Organization: national coordination, surveillance, risk communication and community engagement, diagnostics, port of entry, case management, will require recommitment. Surveillance is needed as there is less testing around the world. In some places, there are about 5 tests per 100,000 population, unlike maybe 100 that was expected. That's not too good. That is making it almost impossible for the global body to be able to have an understanding of what the virus is doing in the nations. And so there is need for more surveillance, there is need for more testing in all member states, including the United States, the Caribbean, the Americas, the European countries, the African nations, the Asian nations, the Eastern European countries, those in the Middle East. Global health security at the World Bank will be discussed, and the mechanisms of operation put in place so that in preparing and stopping future pandemics and catastrophes, lower and middle income countries especially can be able to access the finances and the funds that they need so that they are prepared plans are translated into appropriate responses, be they at national level or regional level or state and local government level, counties or municipalities or cities. Shots in arms, quality and quantity that is required and expected to be delivered where they are most needed. The World Trade Organization's participation will look at patency rights and the possibility of producing generic drugs in certain communities, nations, and continents where they can be used easily by the people. The United States was committed by the Biden administration to provide 1.2 billion vaccines, COVID vaccines, through ACT Accelerator and other channels to the world. And true to their commitment, the United States has provided almost 530 million COVID vaccines to hundreds of countries around the world. That is commendable, and the US is committed in doing more. Those of us who were trained to apply the 8 pillars of the WHO preparedness and response to the nations where we find ourselves as support experts, have worked with city governments, mayors, city councillors. We've been in the community. We've been part of risk communication and community engagement. We've worked with chambers of commerce, the different district communities, legislators, senators, parliamentarians. In our meetings, briefing meetings with Dr. Tedros, the Director General of the World Health Organization, for 2 years, the 2020 World Health Assembly, which was visual, the 2021 World Health Assembly, which was visual, the UNGAS, or the United Nations General Assemblies, had global leaders come in and address most of the issues related to COVID, and then exchange best practices which were shared. So there will be review and there will be discussions around COVID, but going to the 75th World Health Assembly in Geneva from the 22nd of May 2022, the world wants to focus again more on some of the everyday health challenges that is facing. Presently, we know that millions and many millions of people are dying from NCDs or non-communicable diseases, or what we call chronic diseases like diabetes, cardiovascular accidents, strokes, chronic obstructive lung diseases, and others. Poliomyelitis, new outbreaks of hepatitis, which have been reported by the CDC, and other challenges. And so the World 75 or the World Health Assembly 2022 will be investing and appointing a new Director General. Fortunately for Dr. Tedros, he's only candidate, which means that most of the nations are satisfied with the work that he has done with his team, and they are ready to give him another term. So he will be the only candidate, and without any surprises, he will continue as the Director General come the World Health Assembly 2022. We are global health experts who have had multiple years of work in COVID-19 preparedness and response, and will be virtually also participating in the summit tomorrow virtually, being part of the discussion virtually, and listening to what the President Biden and the African Union chair from Senegal, the G20 chair from Indonesia, and the G7 chair from Germany, and the CARICOM chair from Belize, and US President will be saying.